And for our third presentation, I want to welcome Amy Gardner, a PhD student in philosophy at Marquette University, and Joshua Evan Caine Welch, a master's student in philosophy at Eastern Michigan University, together presenting Ontological Technology and Multiplicitous Selves. Welcome, Amy and Joshua.
Can you guys hear me all right? Cool. So this presentation came out of research I started at the end of undergrad looking at patients with borderline personality disorder and the experience of dignity and self-compassion in inpatient psychiatric care. And it's developed into this presentation paper we co-wrote on applying Heidegger's notion of technology to acute care units with psychiatric patients. So I'll go over Heidegger's concept of technology in patient psychiatric care as technology, specifically acute care units and residential care. The idea of an ontological technology, then Amy will talk about being between worlds and multiplicitous selves is kind of the result of this process. So I think the best way to think about Heidegger's notion of technology is as a process of interpretation and interpreting things in the world. And in that sense, it's a process, I believe we could say, of enframing, revealing, and standing in reserve in a simplified way. That's what I would say. So enframing would be the process of I interpret this thing, let's say he uses the example of a block of silver, I interpret it as potentially being a chalice. If I'm a blacksmith, then I can go through the process of turning it into a chalice, which would be the process of revealing, and that it's standing in reserve as this item which has been kind of transmutated. And I want to keep in mind Heidegger's distinction in his discussion of assertion between apophantic predicate and hermeneutic predicate. So that would be the hermeneutic as, which is like, I relate to the world as in, I interpret this block of silver as potentially being a chalice versus looking at this block of silver and saying, oh, this is a chalice. So the hermeneutic as would be a phenomenological way of viewing things and making assertions about our relations in the world. So it'd be inherently relational and standpoint dependent, like what Amy could say about the chalice would be inherently different in a hermeneutic sense than what I could say about the chalice. Versus if we're going to speak about it apophantically, it's quote unquote objective, if you would say. It's about an absolute quality of the item. It's binary, it's true or it's false, and it's not relationally dependent. And I want to keep this in mind because I think this plays out as a tension throughout the process of psychiatric care, like in diagnostics, as well as the way patients are treated in general. It's true, like, let's say you go in, you get a preliminary axiomatic diagnosis, okay, you fall along the lines of depressed, so it could be said the patient is depressed in an internal analytic sense, looking at the medical model, but it could also be said to the patient, it could be said we interpret you as depressed based on this specific model, but statements also get made like you are depressed, like this is core to your being, and that this tension plays out in the hermeneutic sense and becomes an issue for the patient in terms of the creation of the experience of multiplicitous selfhood. So now I just want to go through and so this is Heidegger's quote from the Der Spiegel interview where he talks about the possibility of humans being inframed by technology. And the idea here is that under the apophantic form of value predicate and interpretation, it could become the case that we are acting out the technological process rather in terms of being under its control versus us working through the process. Like you could only see the silver as potentially being a chalice. You couldn't see it as anything else under the apophantic form of predication. And I just want to keep this in mind to show that I do think this value predicate distinction underlies his later discussion of technology. So I want to talk about this concept that we came up with of cultural medical revealing and talk about mechanisms of enframing as well as mechanisms of revealing. And we draw on Foucault's notion of the medical gaze to talk about this idea of medical enframing. And then we also talk about mechanisms of revealing within inpatient psychiatric care like psychopharmacology, as well as milieu therapies and more, we say coercive based on the literature, but methods such as restraint and things like that as they come up being needed, and how this results in a form of standing in reserve, both for the purpose of the medical model is we can organize these patients into these categories. And also in terms of just waiting to leave treatment and step down in care or return to a world outside of treatment. How am I doing? Okay. So Foucault's notion of the medical gaze, how we interpret it is it's mapping medical knowledge onto the body or onto the psychiatric subject. So and this kind of draws on the notion of a patient could come in and they could be asked all these sorts of questions, and that could result, to them it's this, I'm sharing my experience, but it results in this form of categorization. Like you fit the category, let's say a cluster B personality disorder because you're sharing these experiences you have would fit a list of traits. So we determined that to be an aspect of the medical gaze, which is inherent to the process of framing. And again, that could be partially apophantic and partially hermeneutic. The line gets blurred. It's not as distinct as Heidegger makes it seem in his discussion of assertion. So cultural medical revealing, we think there's both explanatory models and models that are used for actual intervention with the patient. Explanatory models such as the DSM, the biopsychosocial model of understanding the patient, as well as like cognitive behaviorism, like an antecedent event model, to understand what's taking place in the patient's life. And we think this collapses as this distinction because there is a fusion of horizons. Like you're asking the patient questions, you're trying to understand their life, but it's also being placed, you're also framing them and using this medical gaze to understand what they're going through. And then this determines treatment outcomes and determines medication management and so on. So, and we think that one of the chief issues that comes up here is the notion that part of what happens in treatment is that you're being asked how did you end up in treatment, what do you want your life to look like after treatment, but under these partially apophantic conditions, you have this lens of diagnostics laid over your experience. It's not as simple as, for instance, if I want to be an artist, well, I came into treatment, I'm going to come out of treatment and be an artist. It's, well, now I'm an artist that has XYZ diagnosis. You're framed under these conditions, which then affects your ability to engage in this kind of ecstatic temporality because you've been interpreted in a way that is not being framed by the medical gaze. And we think that leads to this notion of multiplicitous selves, which Amy will talk about.
So looking at sort of the experience that Josh talks about there, we wanted to see what that might look like when you're actually sort of in it, and so we took the next steps and wanted to see what people were saying, and we thought that Mariana Ortega's work on Heidegger as well sort of coupled with this well. And so to start, I'll talk about Maria Lugones's discussion of worlds, since it's a pretty technical definition, and being between worlds relies on it. So worlds in the sense they have to be real, they aren't utopian. Lugones says something like there has to be some kind of flesh and blood people, but that it need not be fully constituted by these flesh and blood people. She says some things of the imagination might be there, people who once were there but are not there anymore, who have passed on might be there, and things that don't overlap in the physical world might also end up in these worlds. She gives the example of, imagine a Brazilian American community. Brazil is important for their world, even if they're in America and Brazil is not in that world, it's still in that world in the imaginary. In addition, regarding scope, worlds could be something like a whole society, but it might be a smaller community within a society, so just keep that in mind. And then finally, and most importantly, people can move between the various worlds, and it might be the case that they can exist in several at once. Thinking back to, say, a Brazilian American community, there is that sort of Brazilian American part, but then they're also in a broader American context, and so they're in these kind of two worlds at once. And so a big feature of being in a world is being at ease in the world, and you can sometimes tell when you're in a different world based on the ease you feel within it. And so the four things that Maria Lugones talks about regarding being at ease in a world is being a fluent speaker, being normatively happy, being humanly bonded to others, as well as having shared a history with them. And so in the paper, we talk about how these four things seem to be inherently cultural, and thus when we look at the medical world, as Josh described, we can look at them as a sort of cultural medical revealing in a similar sense. And so we use these things to imagine when somebody might be at ease in a different way or be more or less at ease. And so we point to at least three worlds in the case that we're describing. there's at least one world that a person is in pre-hospitalization, and then there's the sort of medical world that they enter into, and then there's the one that they're expected to go onto post-treatment. And so these are the kind of worlds that we imagine people are sort of in between. With that being said, with those worlds, we think that Mariana Ortega's notion of being between worlds is a good way to describe this phenomenon. And so to describe what that is for you, she takes Heidegger's notion of Dasein as being in the world, so that's sort of like weighty kind of being necessitating some kind of world, and the Latina feminist notion of worlds that I had just described, and combines them into this sort of being between worlds. And so we had already talked about it, where there are a variety of worlds and you're between them and you're not quite at home in a variety of them. And we described that this sort of cultural medical revealing produces this experience of being between worlds. Now that sounds kind of vague, and it kind of is for time, but here's some things that being between worlds produces. So in one sense, there's a notion of multiplicitous selves. This is not a plurality of selves. It's not like a bunch of them. It's one self that is multiple, so that's something important to think about. In addition, it comes about because the world influences the way a person is viewed, and thus how they sort of see themselves and how they are felt to be a self in the world. And the notion of worlds, you're able to see yourself in the various worlds. You can say, at work, I am seen as not playful. At home, I am seen as playful. And so there are these different notions of self. Myself is playful and not playful at the same time. And we'll talk about what that looks like. But this notion of multiplicitous selfhood comes with a unique kind of temporality. And so it's still a steady, unified flow of experience phenomenologically, like there I am there, and there I am in this other world, but it's not necessarily perfectly linear. We could imagine a more linear understanding of temporality to be, as a kid, I was playful, then in high school, I was serious, and now I am still serious. But with this sort of shifting between worlds, you get a variety of different traits that coexist. And so it's not like here I was and here I am now. It's sort of like here I am and here I am and here I am. There's a variety of different selves. And so you have this sort of coexisting understanding of a variety of selves, and that is the kind of temporality that we think is produced in this model. And so with that, we thought that it was important to discuss what this actually looks like being played out. And so both for people going through it to understand like what might be going on in their experience, and also for those working with the people so that they kind of can better navigate what the experience is like. And so with being between worlds, multiplicitous selfhood, as well as this kind of unique temporality, we think that following Latina feminist tradition, it's important to note that there are good and bad things that come with it. And so in one sense, it's important to know that worlds might not always exist with each other peacefully. They may seek to colonize or assimilate other worlds. So in our model, sort of the cultural medical revealing process might seek to annihilate like a pre-hospitalization model, right? And so you get this sort of like fear that maybe somebody will lose a version of themselves by losing a kind of world. So that's something important to keep in mind. In addition, I talked about being playful and not playful. And so you get this sort of like contradictory notion of the self that's sort of difficult and like tense to pull apart. And so that's something to keep note of as well, that people might have to deal with these contradictions. And then finally, there's a sort of understanding that we had heard already that betweenness is characterized as not quite fitting in anywhere. So there's this sort of lack of a sense of home almost. But on the other hand, writers like Gloria Anzaldúa will say that that means there's a bit of home everywhere. If you have all of these worlds that you fit into, there's a bit of comfort and a bit of ease in all of them, so it's not a bad thing, this sort of being between worlds. It might be scary in some regards, but in others, you know a lot of different norms and you have a lot of different knowledge that you can have, and this often leads to a lot of potential for creativity. And so I don't want to like make it all seem bad. There's a lot of good here, and so we posit it as a sort of like almost neutral understanding, because things like diagnoses are like important, but this is what we posit is happening here. And so with that, we've sort of understood what ontological technologies might look like and how they might play out as being between worlds and multiplicitous selfhood. Thank you.